Hello, it is Katrina Lujan, and I'm going to show you how to eat a cookie through the anatomy structures. So the first structure is your orbicularis oculi, because that helps with the movement of the eye, and you want to see what you're looking at. You want to make sure it's food. And then the second one is your orbicularis oris. It has an upper and lower part. It's located right here. It helps pull the lips together, and it helps close your lips together, so it creates that seal. And it is innervated by the 7th cranial nerve and the facial nerve. Next, we have the tongue, because your tongue is what's going to help you taste what you're eating. It has tons of taste buds on there that help you distinguish between sweet and salty, and it helps move food from the oral cavity for chewing and swallowing. And the point of attachment is the hypoglossal membrane, and it has different regions, of course, and muscles, which I'll get into right now. The first muscle of the tongue, well, one of the muscles of the tongue, is the superior longitudinal muscle, and that's going to help elevate the tip of the tongue, especially if you're going to be eating an Oreo cookie. You definitely want to be elevating your tongue so you can get all the frosting off of it. And the origin of that is the fibrous submucous layer near the epiglottis, the hyoid, and from the median fibrous septum. And then next you have your inferior longitudinal muscle, and that's going to pull the tip of the tongue downward and assist of retraction of tongue. And the origin is at the root of the tongue and corpus hyoid. Next you have the depressor labii inferius, and it's going to pull the lips down and out. And the origin is from the mandible at the oblique line. And then next you have your palatoglossus, and it's going to help elevate the tongue again and then depress the soft palate. And then the origin is the anterolateral palatal aponeurosis, and the insertion of that is the sides of posterior tongue. And then next you have like your riscerus and your buccinator, and your riscerus and your buccinator are like best friends. The buccinator moves the food onto the grinding surfaces of the molars, and the riscerus retracts the lips. The riscerus is superficial, and the buccinator lies deep to that, and the inserts into cornice of the mouth. And they're like right here, kind of like the corners of the mouth. And then you have your temporalis muscle, and that's going to elevate your mandible and draw it back if it protrudes. And it's deep to the mandible. Deep to the macer, which I'll talk next. And the origin arises at the temporal fossa, and the insertion is into coronoid process and ramus of mandible. So what I was just talking about, the masseter superficial muscle of the mastication, and it helps place maximum force on the molars, and contraction helps elevate the mandible. The origin of that is the lateral, inferior, and medial surfaces of the zygomatic arch, and then insertion as at the ramus of mandible. And then we have a medial internal pterygoid, and that's going to help elevate the mandible. The origin from medial pterygoid palate and lateral fossa of sphenoid. Then we have the lateral or external pterygoid, and it's going to help protrudes the mandible. And then the origin arises from lateral pterygoid palate and greater wings of sphenoid. Then we have the mylohyoid, and it's going to depress the mandible. The origin is the mylohyoid line of mandible. The insertion is into the median fibrous raphe and hyoid bone. And then we have the geniohyoid, and it's going to depress the mandible. And the origin is a mental spine of mandible, and then the insertion is into the corpus hyoid. And then we also have the digastrus, and it's going to depress the mandible. It has two parts. It has an anterior and posterior. The anterior origin it lies on the inner surface of the mandible at digastrus fossa. And then the posterior origin is the mastoid process of temporal bone. And these are some of the muscles, just only a few, that will help you eat a cookie. Thank you.